historically, we've always known that people generally develop more problems with their memories as they get older. But actually, we know that that's not everybody. And for those people who develop dementia, it's a much more of a significant problem. And diagnosing it's important because, first of all, it's about clarity. What is the issue? What's going on? And what does that mean? There are lots of different types of dementia, and if we don't start to think about a diagnosis, then we don't get to understand what is going on and driving that behind that. What type of dementia is it? What kind of treatments might be available? And it's not just about treatment, it's also about prevention of things getting worse. So if you know you have dementia, then you can be helped to get in contact with all of the different services that exist in the city and outside of the city that support people with dementia. It's not just about community groups, but it is also about connecting to other organisations, connecting to services that might support you, connecting to volunteers that can help guide you in along your journey with dementia. And we know that that really protects people with dementia from having problems along the way. Diagnosis is also really important because it helps me as a doctor know what I should and shouldn't prescribe. So there might be medications that can help people with dementia, but there are also lots of medications that we give for other conditions that can make dementia worse. So as a doctor, when I know that somebody has dementia, I'm particularly careful not to give anything for any other problem that will make somebody's memory problem or dementia worse. I think as a family member, to know that somebody has dementia helps us as carers, helps us as relatives. And so to know if you have a family member with dementia, it might mean that you yourself take part in research or studies for family members with dementia. It might mean that you think about your own risk factors, about what prevents you getting dementia in the future. It might mean that you as a family member are able to access the support, whether it's online via Alzheimer's Society forums or whether it's in groups for people who are carers of people with dementia, or whether it's advice and guidance from Dementia Forward who provide aftercare after diagnosis. So it's about having access to resources, your doctor being able to manage your condition really well, knowing and navigating your community, knowing what your dementia can connect you to and who else in your community has it.